Right, I just have to bring up. Pin. All right, and it's clunky. Should have done that first. Sorry, I'm operating from one screen. My the slides are on center.
My slides?
The PowerPoint is on
Oh,
is
okay.
being shared. Yeah, you see it?
Yes, yes.
Okay,
Yeah.
great. All right, center. We will get this. All right, let's lights, camera, action. We're recording. Okay, great. All right. Okay. Good afternoon. Okay, we're admitting good afternoon. I'm Gregory Brody. I'm the program manager for community engagement at Undo Medical Debt. I'm here hosting our Students in Action webinar today, focused on medical debt, health policy, and civic engagement. Um, Quick overview of today's presentation. We have closed captioning. It's you can self-select in the options below on the Zoom screen. Otherwise, we'll be distributing this for housekeeping. We'll be distributing this recording and a list of resources that are related to today's presentation and slides following today's webinar. Following that, we'll go over some high-level shifts in federal health policy. And then we'll talk about some national medical debt polling that Undo did over the summer. And then we'll transition to some new work that students can take into account with our presenter from Vot-ER and Civic Engagement. Speaking of, I just wanted to do some quick introductions. I'm Gregory Brody. I'm the program manager for community engagement at Undo. And today I have Marcos Damian-Noyola he's the deputy director of partnerships at Vot-ER. He'll introduce himself later in the presentation in more depth. But in the interim, I wanted to transition to level set and refresh. I know it's been since December. December was the last time we engaged our network and had our last meeting as the Students in Action. But just to re-up the issue at hand that we'll be kind of discussing in more depth today, medical debt persists, right, as a problem. It continues at the scale of $220 billion and affects 1 in 4 people in the United States. And generally, we know from a financial health perspective that currently there's very little savings that people have to buffer the shocks of those medical bills. Medical debt is more prevalent in communities of color, disproportionately affects communities of color. It's the leading cause, continues to be the leading cause of bankruptcy in the United States. And it's recognized through all of that, it's recognized as a social determinant of health. The greatest indicator of or predictor of medical debt is simply getting sick. So whether or not you're insured, whatever your coverage status is definitely certainly part of that. But just getting sick in this healthcare system is the greatest predictor of interacting with medical debt. So a quick refresh on Undo's mission and model. Right, Undo Medical Debt is we raise money to eliminate medical debt. And how we do that is $1 of funds raised is to $100 of debt erased. So when we acquire medical debt portfolios directly from hospitals, we qualify that debt of all the accounts, right, for people who earn 4 times or below the federal poverty level, which for reference, for a family of 3, that's around $100,000 in income, and or if that medical debt is 5% or more of their annual income. So I share that just as kind of where we're at. The issue persists with medical debt and Undo's model and the work that we do every day as a service organization. In addition to that, though, our work with our students that we continue to think through. And sorry, one other update. We've had recently we just surpassed abolishing $25 billion of medical debt. 25.3 and counting of for over 15 million families. We're really proud of this number. However, it's also continues to be a drop in the bucket for that $220 billion that affects the country today. So I just wanted to share that update. The number keeps going up. We're really proud of it, but it also is an alarming number about the issue at hand. So speaking of upstream interventions and other work we do at Undo, wanted to talk and kind of level set, just high level on the shift that we've seen based off of the HR1, the budget bill, or the One Big Beautiful Bill that was passed over the summer. So it was passed over in July. This isn't an exhaustive list, but this is just to give us a vocabulary and an understanding to kind of use as a tool so that we can grasp what's going on in this moment, which will help us think about actions that we can take later. So the HR1, the budget bill, represents the single largest cut to healthcare in U.S. history. So that alone is pretty is pretty alarming. How that's been done, there was specifically a $1 trillion cut to Medicaid. That's over 10 years. So most of these figures are projected over a 10-year life cycle of how the bill unfurls. So over, again, nearly $1 trillion is being cut from Medicaid. And through that, what we'll witness and what we're experiencing and projecting is that over the next 10 years, at least 15 million people will lose coverage. Coverage in a sense of not just Medicaid, but also marketplace. So different forms of insurance that we won't go into. But those numbers are pretty staggering, even in the context of a 10-year projection. In addition, the budget bill creates more hostility to marketplace, which is Affordable Care Act coverage. So not to go too much into that, but there's employee-sponsored coverage, right? Where you work, you gain, access to health insurance. There's Medicaid or federally available coverage, such as Medicaid and Medicare. And then there's the marketplace insurance, Obamacare, Affordable Care Act, that are marketplaces that are for people who do not have access to employee-sponsored and are not eligible for Medicaid. This is a huge resource for people in this country, and it's been historically inaccessible and unavailable because of how expensive it is. And in 2020, during Biden's administration, they created tax credits to make it affordable. And those tax credits, we saw a record spike in enrollment in this insurance, and we've maintained it until HR1 and the budget bill. And I just wanted to highlight that. I know that's very technical, and please reach out to me. We'll have if there's any other interest, I'll include resources, but I don't want to belabor this, but it just helps us with the tools on how we can analyze the moment and read the landscape. The government shutdown back in the winter. It was if you look back, it was the enhanced premium tax credits that were the fulcrum of what would result in the shutdown. Republicans did not want to extend the premium tax credits that have made America, the ACA marketplace plans historically affordable and record rates of coverage. And so now we're continuing the premium tax credits are now being unextended. They're not going to be around. So we predict more loss of coverage, right? So not only is Medicaid being cut, but now marketplace plans that were once being affordable through a tax credit, through a premium tax credit, are now being thrown away as well. So I just wanted to share that. That's kind of the federal overview. And again, we'll have more resources. Undo has a few blogs to share about that. And so to contextualize that, we did some polling over the summer, and what we're noticing is that this moment around healthcare, there's a lot of unity, a unique amount of unity from voters, a bipartisan level unity around healthcare, specifically around the cost of care and medical debt. And so that prompted us to think through, this was done over the summer. We wanted to sample nationally voters across Republican, Democrat, left and right, independents, We wanted to survey and get some insight on how people were feeling about healthcare, how people were feeling about the cost of care, and how they were voting through that. So we had 4 focus groups um, with voters. We partnered with a firm just for reference. We didn't do this all ourselves. And then we had a national survey of over 1,300 voters submitted to us. And again, that was through the summer into the fall. So this is considered a nationally representative panel of all the data that we're about to walk through really quick. So something I want to highlight is that what's apparent from the results is that voters are struggling, right? And there's a lot of sacrifices that are being made and that are being documented, right? So in response, we had people were eating less or bought less expensive, unhealthy, and resulting in unhealthier food. People skipping vacation, people putting more expenses on their credit card, such as groceries, right? We consider credit cards for different expenses, but this is for necessities. People were taking on more hours at work, if not a second job, falling behind on bills, often resulting in debt or interest, borrowing money from friends and family, taking installments or payment plans, and borrowing against their retirement, right? These are all concerns. These are already concerning like economic behavior, right? Um, Through this study, we found that 68% of the voters made at least one of these sacrifices in the last 12 months, right? That's pretty staggering considering how extreme, right? Any of these measures are to preserve your, financial and physical health. Um, a staggering 68% reported that, right? So we can say with confidence, people are struggling, right? If this is the state. We um we captured a lot of quotes from the focus groups, and I'll just read that, right? We heard from one woman that she goes to a food pantry and works 3 jobs, right? And yet it's still hard and shouldn't be that hard. She doesn't have time to spend with her kids, and um and that's what makes it hard, right? She has to work to eat and navigate that accordingly, right? This is something we're hearing across the board, but we're hearing in different regions from rural to urban, and across different party affiliations. So another result that we found is that voters generally, there's a lot of unity again around voters not thinking healthcare is generally affordable. So when we ask them how they think, right, 69% voted that they found it not affordable. So almost 70%. And if you can tell below of the people that voted or that have submitted that it was not affordable, 68% identified as Democrats, 66 as Republican, and 72 as independent. So that's pretty high overrepresentation of a bipartisan take, right? 31% reported that they found it affordable. But over 3/4, right, are sharing that they find healthcare not affordable. So, and as far as what they've struggled with in healthcare, right, dental, um, having trouble affording their deductible, and again, reiterating what a deductible is just the amount of healthcare you have to pay upfront for your insurance to even kick in. It's kind of confusing, but we can, there's more resources on that. People struggling, so even affording their health insurance, affording their monthly premium. Your monthly premium is essentially the fee that you pay for your health insurance every month. It's just referred to as a premium. People are struggling affording co-pays to doctors and affording prescriptions, right? So 45% of voters of this representative panel are struggling with at least one of these costs. And I won't read these, I'll just give a moment, right? People are, when confronted with a culprit for this issue, we're hearing a lot from people that corporate greed is to be accredited for the high prices. So I won't read these out, but I'll just give you all a moment to read through and take a moment with just ways that people are observing Who's responsible or what's responsible for this? So in addition, one third. Oh, and sorry, something I should have flagged in the beginning. So this, a lot of the focus groups were, we did garner people who have experience with medical debt, either currently or have had issues with medical debt in the past. That was for the focus groups specifically. Um, but one third have medical debt and half worry about how medical debt when worry about medical debt when they use healthcare services. Sorry. So 35% of voters currently have debt due to medical or dental expense. 52% of the voters are concerned about going into medical debt when they use medical or dental services. And 35% of voters say they skipped medical care in the last year, experienced pain, or cut pills in half due to fears about medical debt. So not only is that an issue generally, right? But we know specifically with our health, avoiding the care that you need is not only an immediate, right, issue to your health. It's a long term, it's a cyclical issue to your health. Avoiding the doctor one day doesn't just hurt you that day, it hurts your health writ large, right? When you avoid the care, when you feel inhibited to access the care that you need, your health is impacted. So something that we talk about a lot at Undo and that we hear a lot from our constituents is that mental stress is the hardest part of medical debt, right? Your physical health, if you avoid care, is impacted, but the mental stress alone of just the debt is enough, right? When we asked, what do you think is the hardest part of having medical debt? 57% said mental stress and anxiety. Others reported skipping medical care, going to doctors where you owe debt, right? People avoid care just because of the shame of having the debt with the office. Monthly payments, right? Payment plans are often there's best practices for payment plans, but we know that people aren't often set up for success. The impacts on your credit, the high interest that we find on medical debt, and the calls from collectors, right? This man from an urban area in Texas shared that medical debt on your credit report stops you from accessing jobs sometimes, homes, car loans. So much gets in the way between you and the life you want to live because of medical debt. We hear this right across the board. And we know that medical debt um, should not be the cause inhibiting you from any of that success or growth that you need in your life. So we found that voters blame insurance companies most for medical debt, totaling in at 63%. Under that, pharmaceutical companies, right? As far as culprits to blame, this kind of harpens back on the corporate greed more abstractly that we're finding people accrediting to, but more exactly, insurance companies and pharmaceutical companies come out on top, followed by hospitals, doctors, and thankfully patients or other were pretty low. Which I don't think comes as a surprise to a lot of us, right? So trust in doctors and hospitals the most came up, right? Now, sorry. Um, sorry about that. This is pretty important, right? We want patients to have trust in doctors, but we also want doctors to be equipped and hospitals to be equipped with like encouraging that trust and providing that trust. And what we hear a lot is that that trust gets broken, right? But health insurance companies, drug companies, private equity firms, and corporations run the lowest, right? Which makes sense. But our healthcare system is very profit driven. So the drug companies, the private equity firms, and the corporations play a large role in people's health. People want states, right, to act on this. So again, back to the beginning of the presentation, there's a lot of unity on this issue, which is not, you can't say that often nowadays. Democrats and Republican voters share, right? 76% of voters want their state to act and protect them from medical debt. They would feel more positive about their elected officials if they passed laws on medical debt, or would be more likely to vote for state officials who passed laws, right? We know it's a uniquely unifying issue and a uniquely motivating issue for voters. And this is just another tallying of the support for policies. So keep in mind, it's a good for reference. And we have a lot more resources on the policies. Today, I want to hear from Vot-ER more on actions we can take. But please keep in mind, we have a library of resources on the different policies that we can share out. And this slide also just emphasizes that bipartisan support that we cannot underplay enough about how rare it is in our current political climate. And again, seeing this as a unifying, if not common ground issue in policy. So it's unique to healthcare, right? It's pretty divisive, but the issue of medical debt and the cost of care unites. Again, just back to the culprit, insurance continues to be the culprit and the distrusting agent in this, right? We want more from insurance. We pay a lot for it, but voters are not satisfied with the current health insurance system. And over 76% of voters are curious about what a different different system of health coverage could exist, right? It's a pretty inspiring figure. And lastly, on this front, high deductible health plans are a complicated issue, so I won't go too far into it. But it is what a lot of HR1 and the budget bill and a lot of the Republican agenda at the moment is encouraging. And we have a lot of data on the contrary about how people receive high deductible health plans. So I'll stop there. I'm gonna transition and so thank you all so much. I want to think about ways we can take action, and we're fortunate enough to have Marcos here from Vot-ER. And Marcos, if you want to come off mute and I will advance your slides. Keep me posted.
Sweet. Awesome. Thanks, Gregory. Hi, everyone. My name's Marcos. I'm the Deputy Director of Partnerships at Vot-ER. I've been with Vot-ER for about 4.5 years, came from a public health background. And being a part of Vot-ER has been a really incredible journey. Kind of started when it was a smaller organization. And so seeing it grow now to a network of over 80,000 health professionals that are actively engaging folks in nonpartisan healthcare-based civic engagement has been really incredible. We also partner and work with over 1,700 participating sites. And these sites range really from anything that's healthcare related or advocacy related. So we might be working with nonprofits, we might be working with shelters, but we also work with your brick and mortar hospitals, clinics, and of course, any other healthcare associations as well. But why don't I go ahead and get started and move on to the next slide. So there's 4 things that we'll talk about today. The first being the link between voting and health, just going over some pretty high level research. Secondly, I want to make sure that you all understand some of our resources and program offerings. Thirdly, want to make sure that we give you all quick legal FAQ, and of course, leave you with the next step. Can advance. So why don't we start with the link between voting and health? I want to share a really quick anecdote about myself, having to do with my access to healthcare growing up. So when I was in middle school, the easiest way for me to get orthodontic services was for my mom to travel 2 hours east from where I was living in Florida to Miami. And so we would do that round trip every 1 to 2 months. And as you can imagine, that left a lot of time was taken away from my education and stuff because of that. And at the same time, I had a really hard time accessing orthodontic services, all because they would only accept a particular health insurance. I think I was on Medicaid at that time when I was a kid. So it just goes to show how important policy and voting and health are all interconnected. And so here's some research. You can go to the next slide to help illustrate this idea a little bit more. But essentially, what we see at the global, national, state, and local level is that there's a link between voter participation and health outcomes. So this particular index here that you see on the right, the Health and Democracy Index, look to see what voting access looked like and how it compared to health outcomes within communities. As you can see, there's a positive correlation. And so states that have more voting access are typically seeing better community health outcomes. Next slide. So when we're thinking about voting, here's just an illustration of how this is kind of interconnected with these larger systems that we think of, like the structural determinants of health. That's where voting fits in. And ultimately that impacts the causes of poor health or social determinants of health. And then thirdly, the health-related social needs. So the effects of the causes. Essentially, those health impacts that we're seeing are ultimately being impacted by voting, right here at the very top with those structural determinants of health. You can advance. And so the problem is too many people do not have a seat at the table to vote. So when we're looking at the figure of how many people are unregistered to vote, that figure is 62 million. This is actually a new measure, not a new measure, but a new statistic. I believe 2 years ago, it was 72 million. So I actually got to update this slide this year and move it down to 62. So we've been able to register, not Vot-ER specifically, but our country, 10 million more people over the last 2 years, which is incredible. But there's still 62 million more people that need help. And that's almost the entire population of France, right? So we got almost an entire country's worth of people not participating in democracy. Next slide, please. You might be wondering, why are people unregistered to vote? And the really unfortunate answer here is people have just never been asked, right? So about 2/3 of unregistered eligible voters have just never been asked to vote. You might be familiar with some other common ways. Perhaps a friend or family member messaged you or talked to you in person about it. Perhaps you're part of a religious group and learned about voter registration that way. But one of the more common ways that folks are getting registered to vote are through government agencies. So when people are signing up for benefits, for instance, or when someone is maybe visiting a health department, these are the places kind of where folks are getting registered to vote. Next slide, please. So who exactly are these patients? Well, these patients are folks who are already the most disinvested communities within our country, right? So we're thinking of folks that are young, low income, and people of color. So there's this huge overlap of unregistered voters and people that are currently not being served within our healthcare system. And so ultimately, these are the voices that are really important to uplift during elections, and it gives folks an opportunity to, again, utilize their voice and have a seat at the table, that table being democracy. Next slide, please. Back in 2022, the American Medical Association recognized the link between voting and health. They actually recognized it as a social determinant of health. And so this really opened the door for a lot of institutions and some of the health professionals that we work with get more buy-in from their administrators that they work with at their institution. So essentially at Vot-ER, a little bit more about what we do is power building, right? So we don't want it to simply drop in and out of communities and figure it out for them, right? So we have healthcare providers and professionals that go through fellowship programs and other Vot-ER programs, which we'll touch base in a little bit, about how to organize and institute these different tools and resources. Next slide. So let's go over a few ways that Vot-ER helps. If we could go to the next slide. So there's a really unique opportunity here uh, to utilize the trusted voices healthcare professionals have within their communities. So this survey is from 2022, but I actually just looked at the more recent one, and pretty much this pattern still holds true. Healthcare workers, people like nurses, pharmacists, and doctors actually were three out of the four most essentially trusted uh, health professions in the country, right? So it's a really good foundation to have a conversation about voter registration. We really think that this trusted messenger model helps really ensure that we're able to have a very successful turnout rate. Um, and yeah, so we'll go to the next slide. So there's three different ways that folks get involved, or three ways kind of how our resources come. So we have our badges and lanyards. So it's like this one that I'm wearing right here. You can order one for free, and I'll give you all time at the end to do that. But essentially, these badges and lanyards help provide our health professionals a tool to start the conversation. And it also includes, buttons on how to register to vote, helping them find their polling location, which is a system that's all powered through our partner TurboVote. So TurboVote's the organization that helps provide this nonpartisan information. And the cool thing is that if, for instance, a patient signs up to receive text messages or emails about nonpartisan voter registration, TurboVote really helps them get across the finish line. So if there's an upcoming deadline, perhaps there is mail-in ballot deadline. All of that information is communicated by our partner, in addition to whatever communication the health professionals and health institutions are doing. And some of these institutions also integrate some of these digital materials for organizations. So like that QR code, like this background, we have similar materials for folks to integrate this within their waiting rooms. Perhaps it's in the patient visit room. Some nonprofit organizations like associations or advocacy organizations simply reshare these tools. But it's a great way for organizations to um, have a chance to also track their impact. So an additional part of these tools is that you get a dashboard. So this dashboard helps you understand how many people you're able to reach, and it gives also folks some leverage to be a little bit competitive. And we'll talk about a program kind of related to that in a second. And then lastly, we really try to make this as easy as possible for you. So there's a ton of templates, toolkits, and resources that are available in our Shopify that you can get for absolutely free. And I'll quickly plug our t-shirts. So get a t-shirt if you want. They're cute. There's, I think, an astronaut on it. But yeah, big fan of them. Next slide, please. So our tools are undisruptive, optional, and nonpartisan. We completely understand that there are moments in healthcare where it may not be appropriate to ask the question, are you registered to vote? So we trust our healthcare professionals and institutions to figure out when the best time is. For some folks, it might be at the start of a visit, during a visit, or even after the visit when someone checks out. And of course, they're completely optional and nonpartisan, of course. Next slide. So there's three different programs I wanted to chat about today. So our Civic Health Partnership for hospitals and associations, student organizations, really any organization. Essentially, we have our civic holiday programming that happens between August to Election Day. So essentially, there's things like National Voter Registration Day or Vote Early Day, which are mobilization points for communities and organizations to get involved. Secondly, community civic engagement program. If you perhaps work at a federally qualified health center or lookalike clinic, This particular program provides sub grants to institutions to do this work. So essentially, they do it in a few ways. Some might do it through text messages. So, like I mentioned, TurboVote texts folks that sign up through their service, but so do the health professionals or the institution more specifically. So, we're finding that, um, again, when you take a trusted voice from a community and that trusted voice communicates this information about voter registration, you usually see folks turn out right more. Thirdly, our Healthy Democracy campaign is for our health professional students. So, medical students, public health students, nursing students, all of the health professionals in health professional schools are essentially not all of them, but uh, there's a good amount of them that are competing across the country to see who gets to register the most people to vote, essentially. So we use those fun dashboards again to have that competitive nature between our health professional students. And there'll be more information that comes about on that particular program in the next few months. Next slide, please. Just a quick note here, which is that there has been a very long-standing precedent in federal guidelines for voter registration in 501c3 spaces. So the National Voter Registration Act of 1993 actually encourages this type of nonpartisan voter registration at health centers. And so that's why we spent a lot of time working with organizations, particularly health centers, to get involved. And that can look like very different ways. Again, it could look like voter registration, voter education, or any type of get out the vote work that's happening, like an institution sending a text message to remind them that there's an election on election day. Next slide. Again, these are just a few different ways that folks get involved or how it appears getting involved within clinics. So either, health professionals are pointing patients to, these posters, badges, or handouts that we have to offer. They might tell them that their institution has a service that helps them register to vote, but of course doesn't endorse any political party. And fourthly, you we some in some particular states, you are able to help a patient fill out the registration form while, of course, remaining neutral. Texas is a pretty funny one, in addition to maybe one or two other states. So please make sure with your your state law. Next slide, please. All right. So lastly, I want to make sure to leave you all off with a next step to get ready for these. Can you go to the next slide, please? To get ready for these upcoming civic holidays, like I mentioned. So again, Civic Health Month is going to kick off in August. We have National Voter Registration Day coming up September 15th. And we have Vote Early Day, October 27th. And finally, November 3rd is Election Day, of course. So these are, again, are really big holidays, not just celebrated by Vot-ER, but by the entire country. They're run by other nonprofits like National Voter Registration Day. And so it's a really great way to get involved and to utilize the tools that we have to offer. And I want to make sure to give you all the custom link that we made for Undue Medical to order these voter registration resources. So I'm going to have Gregory include that in the follow-up email today. And yeah, so that is essentially Vot-ER in a nutshell. I'm more than happy to answer any questions. If you have any, my email is Marcos, Marcos, at vot-er.org. And I'm sure Gregory can put that in the email as well. But thank you so much for your time.
Thank you so much, Marcos. That is great. And to confirm, I'll have all that, Marcos, you like any of those links, and I'll include your email
Yeah.
just for reference if students want to reach out. But I'll definitely have the link. Thank you all. Thank you so much. I wanted to take a moment just to gauge any questions or any thoughts people are having. There is just have a little bit, we have a little bit of time, but I have so there's one question. One sec. I'm actually gonna. We have one question, Marcos. And I'm assuming the link will have more insight, but do you have to be like in the do you have to be in the medical field? This is what a question of like, or is it university based or people can sign up individually, but I just had a question around if it has to be in the medical field.
Yeah, that's a great question, and the answer there is no. Really, anyone can order a badge. You know, we've had people from like churches order badges. We've had sororities order these badges. So really, these badges are for anyone that wants to mobilize eligible voters to vote and make sure that they have all of the information necessary to do so. One additional resource or thing that I'll mention about the badges and the QR codes that link to the web page that has all of our resources is that we also work with vote writers for folks that perhaps have challenging voter ID laws in their state. Vote writers helps assist with making sure that people can get an ID. We've also just recently started partnering with a the voter protection hotline. I might be getting mixed up with a different hotline, but essentially, this other hotline is a resource that's really helpful for hospitalized voters. So people can essentially chat or call into this hotline and get their questions answered in regard to anything really election related, and they have the expertise to do that. But yeah, great question.
Yeah, thank you. That's a national hotline, I'm assuming, right? It's for
Yes.
that's
Yeah.
amazing. Great. There's one other question around, I guess, insurance and the doctors, which I thought was interesting. They said, don't doctors set the prices, regarding like the insurance and corporate greed. There's I would just share that there's a lot that goes into that, like pricing and stuff, but two things come up for me, which is that we've part of the polling was just how much trust people have in doctors, right? And the healthcare professionals. And I think that also kind of dovetails into the data you were sharing, Marcos, about um that the trust that people have in the healthcare professionals. I will say that pricing is a over determined kind of situation, but oftentimes doctors are not the ones setting the prices. Individual providers, but hospitals negotiate with insurance, among so many other things, for those prices. So just sharing, there's like we can share more resources on pricing, but I'm just letting I think doctors are good conduits for the obviously the clinical care, but they're oftentimes not the ones setting the price. They run their own practice. That can be different, but it's still kind of set by the insurance companies. And lastly, which is also set by how the federal government funds Medicaid. So just to actually end on that note, that $1 trillion cut for Medicaid over the next 10 years is going to have a lot of implications for prices. But we'll have more of those information, more of those resources specific to policies from Undo. This recording, along with all the resources that Marcos was mentioning for Vote-ER, will also be included. Both of our emails as well. So if any interest or if anything comes up in the interim, reach out to me. Anything specific for Vote-ER, please reach out to Marcos. And if there's nothing else, I will let us go. Let me-